Many veterans who are devoid of visible disabilities have acquired invisible scars that negatively affect them throughout their lifetimes. Both visible and invisible scars have severe repercussions for families, friends, communities, and society as a whole. The United States is home to 16.2 million veterans. This represents approximately 6% of the country's adult population. Of those 16.2 million living veterans within the United States, 43% are from the Gulf War era, including Operation Iraqi Freedom and Operation Enduring Freedom. 30% are from the Vietnam War, 4% from the Korean conflict, and less than 1% remain from World War II. Among the U.S. military veteran population, PTSD is one of the most prevalent mental disorders, with studies estimating PTSD rates ranging from approximately 8 to 22%. The Veterans Health Administration, also known as the VHA or VA, offers several evidence-based individual trauma-focused treatment options for veterans, including prolonged exposure therapy and cognitive processing therapy. Although services are available through the VA, it is estimated that less than half of all veterans suffering from PTSD have sought mental health assistance, and of those that do, nearly half have not continued with their treatment. Barriers to adherence for veterans include practical barriers such as work, school, or caregiving demands, emotional barriers such as treatment being too stressful or not feeling ready to communicate, and VA system-related barriers such as scheduling or negative experiences in the past. Therapy or therapist-related barriers also abound, including trouble connecting with their therapist, feeling pushed too fast into therapy, lack of veteran buy-in to the treatment, or feeling therapy just wasn't working. One study found that 65% of veterans surveyed after combat duty believed that seeking mental health services signified weakness and cowardice. 60% of those believed they would be treated differently by their leaders and peers if they disclosed any mental health issues. Findings indicate that male veterans may be reluctant to initiate PTSD care due to social stigma, distrust of the military or mental health care system, and a desire to avoid reliving their trauma. Veterans with PTSD have an increased risk for homelessness, depression, unemployment, drug abuse, alcoholism, further mental health disorders, and suicide. According to the 2023 National Veteran Suicide Prevention Annual Report, in 2021, 6,392 veterans died by suicide, many of whom were documented to have been diagnosed with PTSD. Family relationships have a significant role in veterans experiencing PTSD. Spouses and partners of veterans diagnosed with PTSD can strongly influence mental health treatment initiation, support treatment retention, and may help with treatment motivation. Peer support is a model that has been increasingly utilized within the VA. It is where patients in recovery from an illness provide emotional, instrumental, and informational support to patients with the same disorder, and has been used to augment existing care for PTSD. Veterans regard peers as more trustworthy than VA providers. Veterans also feel they understand one another better than any civilian ever could. Combat veterans, in particular, are likely to feel greater understanding from fellow combat veterans. Historically, among veterans, service dog use has been primarily focused on meeting the needs of those with visual, hearing, or mobility impairments. However, there has been a recent increase in both discussion and research regarding the use of service dogs among veterans coping with mental health conditions, especially symptoms of PTSD. There has been recent research evidence linking gameplay to important factors in mental health recovery and positive well-being. Participants described using games to distract from overwhelming symptoms, including suicidal thoughts and drug or alcohol use, and many found social benefits, inspiration, and insight through gameplay. Research authors contend that reclassifying PTSD to PTSI for post-traumatic stress injury may mitigate the stigma of the veterans' wounds, increasing their willingness to seek aid and improving their chance to heal. As nurses, we need to support and encourage our veterans who may have PTSD to seek out treatment in order to have a better quality of life.